National COVID-19 Immunisation Program, or also known as PIC program, is the largest vaccination program implemented by the Malaysian government through Ministry of Health to combat the spread of COVID-19. But first, let me describe the background before the implementation of the vaccination program. Ministry of Health is the Malaysian government's ministry in charge of the health system, was established in 1955 to ensure that all Malaysians have access to high quality and low cost medical treatment. Since August 2021, Khairi Jamaluddin has served as Malaysia's Minister of Health, whereas Noor Azmi Ghazali and Ari Dagang assist the minister. Through Ministry of Health, the minister is in charge of the portfolio, therefore it is responsible of the healthcare system, including public health. In 2020, a serious threat to public health has surfaced. A coronavirus or COVID-19 outbreak occurred in Wuhan City, China in December 2019 and rapidly grew around the world. According to Berita Harian, the first case of COVID-19 found in Malaysia on January 25, 2020 and was linked to 3 Chinese nationals who had previously had a close contact with an infected person in Singapore. Initially, Malaysians were unaware of the seriousness of the coronavirus until News Straits Times reported that the number of COVID-19 cases rose from 99 on March 8 to 200 in less than a week, with the first 2 deaths recorded in mid-March. Therefore, the Malaysian government implemented a number of measures to calm the public and to protect the Malaysians' health. The Ministry of Health played a critical role in ensuring that Malaysia was fully prepared to stop the infection of COVID-19. Therefore, on February 26, 2020, Malaysia launched the country's largest vaccination program to protect the public from the virus. The main objective is the government aims to guarantee that as many Malaysians as possible to receive vaccine to protect their lives, because vaccines are a great weapon in the fight against COVID-19, according to WHO. Furthermore, the implementation of the PIC program is one of the Ministry of Health key functions during COVID-19 pandemic. Since early 2021, COVID-19 Vaccine Supply Access Assurance Special Committee (JKVASS) has been in charge of this vaccination program. It serves as key planning, monitoring and implementation for the entire PIC program. Besides that, COVID-19 Immunisation Task Force (CITF) was formed, with Khairi Jamaluddin serving as the coordinating minister to guarantee the seamless operation of the PIC program in order to speed up vaccinations of the country's adult population. Moving on, with the national COVID-19 immunisation program intensifying, NGOs and other volunteers have been encouraged to help the government to carry out the COVID-19 vaccinations. According to Protocol Health Corporation CEO Alam Anas Faizli, since July 6, NGOs such as Mercy Malaysia, Emarat and others have been vaccinating bedridden patients and those who find it difficult to get to PPVs for their vaccinations. With that said, these collaborations are projected to boost the number of COVID-19 vaccination registration in the country and thus allowing the PIC program to achieve its goals.
The question is, what is the reason for the Malaysian government to implement the National COVID Immunisation Program as an initiative to curb the COVID-19 pandemic? Well known, the health crisis was the reason for the formation of this program. But other reasons can be seen, such as the unemployment, poverty and economic deprivations. Firstly, the insistence on the economic problem in the implementation of the PIC program. The contraction of the country's economy is the result of the disruption in the economic chains domestically and globally. During the pandemic, the contraction in the country's economy in 2020 at 5.6%, the lowest rate since 1998. This situation was boosted by the global economic downturn of 3.5% in 2020 and declined the Malaysian's gross export to negative 1.4%. Second sources of problem was unemployment. The restriction from the movement control order causes the economic activities to be unworkable as usual and causes some industries to close their businesses, shrink the workforce, voluntary separation scheme and retrenchment scheme by mutual agreement. This drastically affects the unemployment rate in 2020 at 4.5%, increasing about 2,000 people unemployed compared in 2019. The last problem is the poverty. The poverty happened due to the effect of the economic contractions plus the issue of the unemployment that affect the income of the community and also contributed from the dwindling debt and saving liabilities. This strongly supported by the poverty rate in 2020 compared to 2019 at 8.4% and 5.6% respectively. Therefore, the most important is to call various parties such as the government, public, private, NGOs and others together to solve this problem through vaccination to accelerate the national herd immunity process through the PIC program.
Next is program mandate. The most recent movement control order, which started on 12 May 2021, has caused a daily loss 1.1 billion in academic term. Therefore, the government has recognized the urgent need to loosen sanction and intend to implement them to methods that do not squander the success that have been achieved in fighting the virus. On 15 June 2021, Yang Amat Berhormat Prime Minister Tan Sri Muhyiddin Yassin has announced the National Recovery Plan towards easing the restriction. This action plan explains in more detail the current plans in controlling COVID-19 pandemic and at the same time the economic and the social reopening in stages towards the new norm. According to the National Recovery Plan Report 2021, the NRP focused on 3 indicators for the progress of achieving objectives in relaxing the restriction. First indicator is COVID-19 transmission condition in the community based on the number of daily cases or infection. This is subject to a positivity rate of 5% or lower, which means that not more than 5% of cases tested in Malaysia are positive. Second indicator is the utilization of intensive care unit, which is ICU, that provide a good indication of the capacity of the system as it is a major constraint in most angles. Then, the last indicator is percentage of the eligible population who have received full vaccine was used as the primary metric. Besides, the successful implementation of this plan will necessitate a nationwide approach. Then, the nationwide coordination will led by the new coordinating body, which is National Rehabilitation Council, which is NRC, and it also chaired by the Yang Amat Berhormat Prime Minister with the National Economic Implementation Strategy Coordination Agency, which is Laksana, and the Ministry of Finance as the Secretariat. On this matter, NRC mandate is to monitor, coordinate, and ensure the success of National Recovery Plan. Then, the implementation of this mandate spans 6 areas that involve standard operating procedure, which is SOP, healthcare system, vaccination, economic rehabilitation, social and welfare, and also stakeholder involvement. In further clarification, vaccination is the most critical step in reopening the country. Then, COVID-19 Malaysia immunization policy includes the distribution of vaccine supplies as well as the prioritization of vaccine recipients based on their health concern. Therefore, all citizens and residents are aged 18 and above are covered by the current National COVID-19 Immunisation Program, which is NIP. Apart from that, the national goal is to have completed vaccination of 40% of eligible population by August 2021, 16% of the population by September 2021, and 100% of the population by October 2021. To achieve these goals, the government strategy is based on the 3 pillars such as securing strategic vaccine sources, speeding up vaccination delivery and uptake, and also improving the vaccination experience. On the other hand, according to Senator Dato' Dr. Zulkapli Muhammad Al-Bakri 2020, the special meeting of the Muzakarah Committee of the National Council for Islamic Religious Affairs Malaysia decided that the law of the use of COVID-19 vaccine is a must. It can be seen that the use of vaccine to protect the human being infected with dangerous disease is not a foreign from Islamic perspective. In fact, the law on its use has started since 1988. Thus, in the issue of taking COVID-19 vaccine, it is a ruling set by the government. This is because the government required to decide something the most maslahah decision to the whole people after arbitrating various factors as well as obtaining the views from the party who are expert on this matter. Aside from that, COVID-19 vaccine is also regulated and complied with few acts such as from Poison Act 1952 in bracket Act 366, the Sale of Drug 1952 in bracket Act 368, Drugs and Cosmetic Control Regulation 1984, and also Infectious Disease Prevention and Control Act in bracket Act 342. This is because all import, supply, sales and distribution of vaccine human use must comply with the provision existing law of the country.
Next is SWOT analysis. First, I will begin with the first trend discovered, which is experience. Dr. Nisham stated that the previous experience with viruses such as Nipah, SARS, H1N1 and MERS aided the Ministry of Health in making adequate preparation and promoting healthcare to deal with the COVID-19 pandemic. The experience in the National Vaccination Program since 1950 has helped the government to cope with any situation. Plus, this can be seen when Malaysia adopted the experience of vaccination program in other countries by following international protocol that recommend observing a person for 15 to 30 minutes after receiving a vaccine injection to monitor for side effects. As a result, separate room in the PPV is provided so that each vaccine recipient can be observed within 30 minutes of being vaccinated. Second, managing the program execution capabilities provide an advantage in the implementation of vaccination program, as the existing workforce is trained and has experience in the field of immunization activity. Outbreak control guideline as well as existing equipment and expertise can be applied with the improvement fit to the current scenario. Therefore, MOH is convinced that by adhering to the same principle, they will be able to combat this cluster of COVID infection. Third strength, Malaysian whole of government approach help the program meet its objective. Instead of focusing on PPV, the MOH operate as an advisor with the collaboration of NGO and private sector by allowing the administration of COVID-19 vaccine through private medical practitioner and government health center nationwide. For example, MOH appointed Protect Health as an implementer of involvement of private medical practitioner and NGO due to its extensive experience and skill in fulfilling strategic purchasing role. With the engagement of all parties and appropriate infrastructure, the immunization program may reach more people and be completely executed. For the winners, absence of vaccine research and development facility result Malaysia to place an order from the country of origin to obtain the vaccination. However, there has come delay in national immunization program. Weakness in making vaccination purchase decision will rise and become an issue. Malaysia was taking a long time to approve the vaccine, although other countries already prepared to use Pfizer. This is because the decision of NPRA and the MOH take 19 to 120 days to determine whether to use or reject the vaccine. Hence, Malaysia is far behind in terms of vaccine delivery as the first agreement with Pfizer was signed in November, while other countries such as Japan signed their first agreement with Pfizer in July. And by the end of September, many countries such as Vietnam, India and Australia had agreement in place with various vaccine manufacturers. Apart from that, the excitement of millions of Malaysians for AstraZeneca injection was spoiled when the vaccine COVID website crashed due to heavy traffic. Plus, many people are unable to make reservation as the vaccine slot is already full in less than an hour, despite the fact that 1.26 million vaccine doses were previously announced. According to Dr. Mohd, the method of vaccine registration through MySejahtera application and online is mainly due to bureaucracy, which slowed down the country immunization program. Next is opportunities. While the COVID-19 cases in Malaysia is escalating, the former Prime Minister Mohd believes that increasing vaccination capacity is the most effective way to bring Malaysia out of the COVID-19 crisis. This crisis presents an opportunity for the government to take the lead by establishing Operation Surge Capacity to increase immunization rate, particularly in the Klang Valley. Day by day, the result of the group immunization help lower the number of daily cases, what immunization rate, and fatality rate caused by the COVID-19. Further, the government obligation for full vaccination is one of the opportunities for the success of the program. For example, the government announced in September that cross-state travel will be permitted if the country achieves 90% adult immunization rate. Also, the requirement for civil servants to get a full dosage of COVID-19 immunization in order to avoid actions such as termination of service. As a result, many individuals flock to obtain the vaccination and the country adult population COVID-19 immunization rate reached 90% in just a few weeks. Lastly, the threat is monopolies among wealthy countries such as UK, US, and European Union threaten the efficient operation of national immunization process. According to Kari Jamaluddin, the immunization program is moving slowly due to the poor delivery of vaccine, unequal vaccination distribution, as well as supply failure to produce adequate vaccine. These have impacted the vaccine supply to Malaysia and impeded the government effort to offer up to 400,000 immunization per day. Plus, the emergence of new variants of the virus abroad is likely to interfere the effectiveness of national COVID-19 immunization program. Travelers from abroad, especially from countries with high rates of COVID-19 infection, are at risk of increasing the spread of disease into the country. The consequences of COVID-19 mutations, such as Omicron and Delta, have generated widespread worries about the efficiency of the vaccine provided. As a result, the administration of the COVID-19 vaccination booster dose caused an unfavorable view among the public who perceive it is as a part of the government agenda. First, the horizontal integration strategy entails integration across the sector or institute at the local level. Through this strategy, the government used the concept of whole of government approach and whole of society approach, which encompass collaborative effort conducted by multiple governmental bodies, NGO, and other private organizations to propose collaborative solution to specific problem or concern. For example, the state government and local authority act as a license to the local community to instill trust in the local community about the safety and efficiency of vaccine and to assist in logistics at the mobile vaccination center based on local community needs. Furthermore, the government is collaborating with health NGO by allowing the establishment and operation of PPV. Approval for health-related NGO to organize PPV integration is to focus on individuals who have difficulty attending PPV in big cities, such as those living in rural regions, orang asli communities, the elderly or homeless recipient. Next, market penetration strategy in intensive approach play a significant role in expanding the scale of business operation through increased marketing effort in this national immunization program, such as raising the quantity of PPV, increasing advertising spending, providing widespread immunization initiative, and increasing publicity effort. This can be seen in the collaboration of MCMC with Strategic Communication Division of the Ministry of Communication and Multimedia Malaysia in delivering material and important message to the community via private TV and radio broadcasting. Furthermore, it involves other parties such as National Security Council and other 40 telecommunication service providers such as Celcom, DG and assist in spreading vaccine awareness message across the country via SMS and social media platform. The government also conduct outreach program in village and rural area to assist public, particularly the elderly who are having difficulty registering as COVID-19 vaccine recipient through the My Syahiratul application. This was followed by walk-in vaccination and mobile PPV on people who have left out and have not received their appointment.
The most effective strategy for combating COVID-19 is widespread immunization of communities all across the country. However, immunization that are both safe and effective are still a problem faced by Ministry of Health in implementing the PEAK program. Safety immunization can be classified as the integrity of the vaccines and the administration of the vaccines are all issues that health workers must consider. This is because, in order to succeed in the national drive to provide vaccinations to all Malaysians rapidly, government has confronted concerns regarding the effectiveness of the vaccination procedure. One of the biggest concerns is people are being injected with empty syringe. Multiple claims of people are being injected with empty syringe went viral on social media since Malaysia's immunization program began. The Star 2021 reported that human error has resulted in a 12-year-old getting vaccinated with an empty syringe at Universiti Malaya Vaccination Center. The health worker took an empty unused syringe that was on the same table as the vaccine-filled syringe by accident. As a result, people's trust in the vaccination has been eroded due to the alleged horrified acts performed by certain health workers. Human error mentioned earlier due to the health worker being under a tremendous pressure throughout the COVID-19 outbreak. Dr. Victor Zhao, the president of the National Academy of Medicine, said that the health workers were twice as likely as the general population to experience burnout before the pandemic, and the situation has gotten worse since the beginning of the pandemic, with people suffering from fatigue, depression, and lack of sleep. The pandemic has been particularly traumatic for individuals working in the healthcare because they work non-stop to halt the spread of COVID-19. As prevalences of burnout has grown, millions of people who have been vaccinated have begun to have worries about the integrity of their vaccine. Therefore, this incident should not be taken lightly as it could threaten the confidence of the public in the country's immunization program.
The next barrier can be seen through COVID-19 vaccine misinformation and the movement of anti-vaccine. Misinformation is increasing as fast as COVID-19 transmission. Both occur as a result of the use of social media and technology. On this matter, the rise of internet access and social media use has exacerbated for the infodemic. In addition, users of social media have active in disseminating fake news, hoaxes, and conspiracy across the internet. It can be seen that Facebook, Twitter, WhatsApp, and Instagram has been highlighted as most popular social networking for this purpose. According to the Malaysian Communication and Multimedia Ministry, which is MCMC Secretary, Datuk Seri Mohammad Mentek, there are roughly 28 million social media users in Malaysia as January 2021 since the pandemic occurred and also affected by the people to stay at home a lot of time due to the MCO. With the rise of internet users, it's unsurprising that Malaysia has more vulnerable to misinformation than before. On the other hand, the movement of anti-vaccine has worked hard to disseminate misinformation regarding COVID-19 vaccine, and even going so far as to push false claims of vaccine-related death. On this matter, anti-vaccine will claim that vaccine of COVID-19 will fail, be harmful, and also be promoted by a malicious worldwide conspiracy. In Malaysia, anti-vaccine fake news has been propagating on social media platform in an attempt to discourage people from participating the immunization program. It is because most of them are concerned about the vaccine religious status, claiming that the injection include the ingredient prohibited by Islam. Furthermore, another fake news is when a message viral on social media platform claim that infrared thermometer, which are commonly used to screen people as they enter the building, were inflicting the brain injuries. Moreover, on October 2021, the Royal Malaysian Police has opened two investigation paper against two individuals that believed to be anti-vaccine who spread false news about the related to the administration of the COVID-19 vaccine. Afterwards, another case is an information technology officer was charged in session court on allegation of disseminating false vaccination news on the TikTok application with the purpose to cause public alarm. Hence, the propagation of false information regarding the COVID-19 vaccine and the movement of anti-vaccine were seen to have a significant psychological impact to all the people. This can be harmful because it may result in individuals receiving unclear information and suggestions. Consequently, it led to a reduction of the confidence and trust of the public in government effort on vaccination program to be success.
Further challenges are related to the access of the coronavirus vaccines. The immunization's bubble or herd immunity depend on the percentage of the country's population receiving the vaccinations. But access to the vaccinations remain a challenge, especially the residents in the remote areas, migrants, orang asli and others. As recorded by the Ministry of Rural Development, around 65,000 orang asli had yet to get vaccinated. Furthermore, this incident is not considered orang asli are anti-vaccine. But the process of vaccination is difficult as some of them live far inland. On the other hand, the obstacle to achieve the herd immunity is the challenges of giving vaccinations access to migrant and foreigner. This is because they do not have valid personal document to get vaccinated and had fear of the risk to be caught, detained and expelled from the Malaysia. There is issue where a large-scale operations to detain illegal immigrants to receive vaccinations. This has come under criticism for restriction of vaccine justice, which is it create an unsafe situation for them to get vaccinated. The consequences of that, the foreigners are terrified and choose not to receive the vaccinations.
For the next challenge is absence. The absence of the public to get a vaccine is also a challenge to the national COVID-19 immunization program. The absenteeism for individuals who have been scheduled for an appointment is relatively high, owing to a variety of causes. In fact, many cancellations are made at the last minute or without the prior notice. According to Associate Professor Dr. Yahya Ma'arif, a biologist at the Universiti Sains Malaysia, failure to attend a vaccination appointment could also result in wastage of the dose, as a vaccine taken from storage has a limited shelf life and must be used. It can also cause a damage to the vaccine if it has been removed from the storage. Apart from disrupting a vaccine schedule and stock, appointment also had to be rescheduled and replacement vaccine injection on the day had to be sought. For example, on May 16, 2021, Kelantan State Health Department Director said a total of 1,800 people did not attend the second round of the COVID-19 immunization program at the national level for various reasons. As a result, it had several parties participate in the initiative and face a challenge. Furthermore, according to the Health Minister Khairi Jamaluddin Abu Bakar, around 40% of those who obtain a booster dosage vaccination appointment through the National COVID-19 Immunization Program do not show up on the injection. On October 13, 2021, the National COVID-19 Booster Immunization Program, also known as a PICB, began administering booster dose to participants who had already been completed vaccinated. Some people are still hesitant to take a booster dose because they think the previous two dose vaccination are enough. For the first recommendation is to make mandatory vaccines. Suggestion that can be highlighted for the success of the National COVID-19 Immunization Program is to make vaccination mandatory. The government need to enact a specific law to make it compulsory for the people to take the vaccines if they want to take a legal action against those who refuse to receive the vaccines. People who do not take the vaccine will take it easy on this given that the government does not impose any action on them if they do not take the vaccines. For example, in the country of the Ecuador, the adoption of the COVID-19 vaccines was declared mandatory following the emergence of the new variants. The mandatory measure of vaccination apply to the individual aged 5 years and above. Therefore, the government should create a specific act on the vaccines. Next recommendation is imposing fines. Prof. Dr. Ainul Jariah Maiden, Senior Lecturer of the Faculty of Law, International Islamic University, stated the government had the ability to impose fines on the people who refuse the vaccinations. The government can either change the existing act or create a new emergency ordinance by gazetting the applicable legislation. So far, those who do not receive COVID-19 vaccines injection simply do not get the same facility as the people who have already taken the vaccines, such as a dine-in, tourism activity and so on. Thus, the power of the government to look after the interests of the people where how an economic needs will override the interests of individuals who do not get the vaccine.
The National COVID Immunisation Program is a Malaysian government initiative that's supported by various parties in responding to the negative effect of the outbreak of SARS-CoV-2 virus, which is COVID-19. As discussed earlier, various ideas, problems, views, and suggestions have reinforced the argument that the National COVID-19 Immunisation Program is an effort to neutralize the current situation as it is. There is no denying that the impact of the COVID-19 pandemic negatively impact every inch in our life. Therefore, communities, government, non-government agencies, and all, although it is difficult, need to have consistent aims, cooperations, and support to this peak program for the sake of common well-being and safety. #kita jaga kita.